Hey, I'm Trigger Trauma, and today we are talking about cycling and testosterone replacement therapy. So, short of it is there is no such thing as cycling in a legitimate TRT regime. And the theory of cycling is to take large amounts of testosterone to the point that you've oversaturated the body so much that all your testosterone receptors have uptaken every bit of testosterone they can. There's no place further for the body to uptake testosterone, and so the risk is that the body's going to start converting the leftover testosterone either into DHT or estradiol. So what you have to do then is to come completely off of testosterone in order to clear the receptors so that you can go back to taking your doses of testosterone, and they'll have free receptors in which to bind with and in which for you to get the effect from. A legitimate testosterone replacement therapy regime is trying to give you enough testosterone that you get as many of the receptors full of testosterone as you can without having an excess amount in the body, and getting your levels of testosterone through blood tests within normal limits. All right. And what they're trying to do is to get you to a level where then you are consistently at that level with the least amount of peaks and valleys as possible. So, if they could get you to a point where you're at one consistent number every day throughout the day, then that's what they would be aiming for. And that's part of the reason why microdosing has come about, is some people use microdosing in order to stay at a pretty consistent level every day. I've never done microdosing. It is the thing that I plan on talking to my physician about when I go back and see him in October, because some of the literature, if you're reading it, just says it's more possible to keep yourself on an even keel number. Now, I don't have a problem with the dose I'm on right now, and I really don't feel like I have peaks and valleys, but it'd be an interesting conversation to have with your physician. People who talk about cycling, a lot of times also talk about what they call blast and cruise. Blast and cruise is garbage. Blast and cruise is giving yourself huge amounts of testosterone, overbathing the receptors, having an excess in the body, and then trying to back your numbers down to a maintenance level so that you lose no muscle, but you clear receptors so you don't create DHT and you don't create estradiol, and then hopefully you can go right back to blasting again and gain as much muscle. Now, I'm saying it's garbage as far as a testosterone replacement therapy regime goes. There are some people out there who use it pretty effectively in the bodybuilding industry to gain muscle, and they swear by it. But I'm talking about purely as a TRT regime. There is no blast and cruise. There is no cycling. It's a consistent dose in order to try to get you to a consistent level every day throughout the day as possible, to maintain, as perfect as they can to one number from dose to dose to dose. So, I see comments on here, sometimes questions on here about cycling. What kind of cycle do I do? How often does my doctor take me completely off testosterone? Doesn't happen. I have given myself 150 milligrams of testosterone now every Friday for the last 2.5 years. So yeah, it's just one consistent dose every Friday. So I hope that helps. There is no cycling in a TRT regime. There is no blast and cruise in a TRT regime. Those are byproducts of bodybuilding and strength training and things like those. That's not a medical TRT regime. Anyways, I'm Trigger Trauma. I hope you guys have a good day.